Hello and welcome on behalf of the Center for Global Development and the World Bank, with whom we're pleased to be co-hosting this event today. I'm Sarah Rose, a policy fellow at CGD, and today we're delighted to have a discussion around the World Bank's brand new Afghanistan Welfare Monitoring Survey report that just launched today. This report makes an important contribution to a collective understanding of how the Afghan people have fared in the months after the August 2021 fall of the Afghan government to the Taliban. The Taliban takeover, of course, precipitated a massive humanitarian and economic crisis. Cuts to development assistance, which had previously made up around 3/4 of public sector spending, as well as international sanctions on the Taliban, led to a crisis in the banking sector, which has in turn hampered the international humanitarian response. And so the new survey is really helpful in laying out a data-oriented picture of how these crises have impacted the daily life of Afghan households. So today we'll welcome a summary presentation of the findings by the World Bank, followed by a discussion with a great pair of expert panelists who will reflect on the report. And we also want to hear from you, our audience. And so we'll leave time at the end to address your questions, which you can post to the panel at any time during the event by emailing events@cgdev.org, by tweeting @CGDev, #CGDTalks, or submitting a comment via the YouTube live stream. And so first, to kick us off, I'm very pleased to welcome Melinda Good, the World Bank Country Director for Afghanistan, to deliver some brief opening remarks.
Thank you, Sarah, and colleagues at CGD and colleagues who've joined us for this live event. Sarah already set out for us the broader macro picture that we're facing in Afghanistan. So let me introduce briefly the survey before turning to my colleagues who have done the hard work. This welfare survey is the first in a series of analytical pieces about Afghanistan post-transition. The objective of this first piece is to give a better understanding of how the situation is unfolding in Kabul and around the country. Let me tell you a little bit about how the survey came about. As far back as August, we were all thinking about what would happen in Afghanistan and how we could plan scenarios for that, for our work on the ground, for our financing, and most importantly, for our analytical work. Our team had simulations of the macroeconomic impact of the potential crisis, but it was difficult to understand the micro impact, to verify the transmission channel of the crisis, since we'd lost a lot of our usual sources as people were leaving Kabul and some of the institutions had paused working. So in this situation, the team thought about how to get a glimpse of the real situation in Afghanistan from outside and from within. And so what you see today is a household survey result. Thinking with the team, we realized that already there were some tools in place that could be retrofitted to keep really a pulse on the situation in a verifiable and analytical manner. So what the team did was to combine the telephone survey, which had been rolled out in previous months to measure the impacts of COVID, with the sampling from the standard poverty survey to make it nationally representative, and adding also questions to assess household welfare after the transition. So I don't want to give a spoiler of what you'll see. I'll just say that some of the results may make you question some of the narratives that we've all been reading over the months. I think that's a good thing. We want to spark a conversation. This is the role of the bank, and particularly the team from the bank that you have here and our partners in CGD and elsewhere, to really take analysis and to have an independent source of information and conversation. So let me stop there and hand it back to Sarah and look forward to the presentation and then to the great commentary from our panelists and from the audience. Thank you.
Thank you so much, Melinda. It's a great introduction to the survey, and certainly the point about being able to add information where sort of previous and existing sources of information had been reduced, to be able to add into that, to be able to create this new stream of evidence, to be able to contribute to the rest of the information that we see coming out of Afghanistan as well. And so I'd now love to welcome Ghazala Mansouri, who's the lead economist of the Poverty and Equity Group at the World Bank, focusing on South Asia. Ghazala is going to provide an overview of the survey and highlight some of the key findings and the takeaway messages that the data suggest. Ghazala, over to you.
Great, thank you, Sarah, and thank you, CGD, for organizing the event. Let me start by sharing my screen and so I'm assuming everyone can see the screen. Okay, let me get started. So as Melinda started us off and introduced this is really the first round of the Afghanistan Welfare Monitoring Survey, which we launched very soon after. So this survey went from October to December of 2021, and its objective was to get a quick sense of what was happening to living conditions in Afghanistan under the interim Taliban administration. We basically were interested at this point in getting a pulse on some key indicators. These included what the impact on employment, on earnings, on food security, on access to basic safety nets, school attendance, and access to health services. And so those are the things I'm going to run through today. We do plan follow-up rounds. In fact, we're already in the design phase of round 2, which should go late spring. So let me tell you a little bit about the sample for the survey, because that's important. So this survey actually, it re-interviews households that have been previously interviewed in nationally representative surveys done by the National Statistics Information Authority. These are the series of surveys which are referred to as the Income, Expenditure, and Labor Force Surveys, IELFS. We had data from 2 rounds, recent rounds of the survey. The 2019-20 round, which was completed, and we have the full sample, and the 2021 round, which was actually underway and had to be interrupted in August. So we have about the first quarter's worth of data from the 2021 round. This gave us about 10,000 plus phone numbers of households across Afghanistan, including all of the survey weights, to be able to get a nationally representative view of what was going on. We did attempt to reach all 10,000 plus households for which the phone numbers were available. We successfully managed to reach about a half of them. Of the remaining one half, the bulk, 90%, were actually unreachable because their phone numbers were off. And about 10% of households, essentially of the remaining 5,000, which is about 5% of all households, actually refused to be interviewed. The very small active attrition in the survey, most of it was passive attrition because of non-working phone numbers. Because of this, we did have to reweight the sample using the original sample weights and reweighting them to account for the potential biases that could be introduced by the fact that we could not reach some of these households. And so what you're going to see, these results are actually with correct sample weights. So they are nationally representative. Let me go to the findings then. So we're going to run through the key findings. I'm going to start with employment. So the key issue on employment that we see is that there are just, there's quite a significant increase in people looking for work. So this would be folks, household heads in particular, whom we are able to reach between the ages of 15 and 65 that were actively looking for work increased. So the economically inactive group in that age group declined quite dramatically from 16% to 5%. So just more people came into the labor market, largely in urban areas that fueled unemployment. So you can see in urban areas, the unemployment rate actually rose, or household heads reporting unemployment rose from 8% to 21%. The proportion of household heads employed actually declined slightly from 75 to 73%, but there's this big change in unemployment. In rural areas, in contrast, there's a small change in unemployment, but the big change is actually in just more people being employed. So this is one sort of issue that I'm sure we'll get more into in the discussion, because there's been a lot of information around what's been happening to employment, a lot of concern around what's been happening to employment. When we try to break this up by sector of employment, we see actually that the employment in the public sector is where we see the biggest hit, a downward trend. The sector declined by about a third, from 12% to 8%. We see a big jump up in informal employment. Private sector salaried employment remained roughly the same. And there's a decline in people working without pay, sort of unpaid family workers. When we break this up by urban and rural areas again, you see that the biggest change actually in public sector employment, unsurprisingly, comes from urban areas. which public sector employment in urban areas, that's the orange bar, went down from 15 to 10%. In rural areas, there's also a decline in public sector employment, but it's much smaller. But in both urban and rural areas, but particularly in rural areas, you see a big jump up in informal sector employment. That includes, of course, employment in agriculture. So when we try to break down public sector employment further to look at how the composition of public sector employment has changed, we see that all of the decline comes from folks who were either in security services, police and army, or who were in public administration. Again, this is not surprising because both those sectors shrank quite significantly. In the case of the security services, went down from 3.2% of household heads to 1%. In the case of administration, it went down from almost 3% to less than 1%. In contrast, household heads involved in education in some way actually went up by more than 1 percentage point, and households involved in health went down slightly from almost 1% at 0.8 down to about 0.5%. What has been the impact of this shift in employment on earnings? So in terms of earnings, we see across the board, regardless of sector, people have reported a very significant earnings shock. So some 70% of household heads in aggregate of employed household heads report that their earnings declined by a lot. Another 17 or so percent in the aggregate report that their earnings declined somewhat. So overall, more than 87% of households report some sort of a decline in earnings, with the bulk of them reporting very significant declines. This does not tend to vary a great deal across sectors. So you can see that about 69% in salaried public, about close to 60% in salaried private, and then 71% in self-employment. The only fact worth noting is that salaried private actually went down by less than both public sector employment and among the self-employed. And that pattern is consistent across rural and urban areas broadly. When we look at the impact next on, well, how has all this kind of shift in employment and labor earnings, the extreme decline in earnings, in particular impacted food security, and what sort of access to safety nets do households have? So let's first talk about what's been happening to food security. So about 70% of households report either that they do not have enough to cover even their food expenses, or that they may have enough to cover their food expenses, but not much more. And when we look at sort of like break that down by, well, that's 70%. When we look at the transition in this between May of 21, which is a recall by the same household heads about their own condition in May of 21, much lower fractions of them felt that they had not enough for food, or had only enough for food. So there's more than a doubling really of household heads reporting that this kind of extreme duress, where not having enough to eat or having enough for food, but not much more. We look at that then in contrast to look at, well, how are households then coping with this decline in their capacity to cover basic expenses? And here we actually added to the survey the same module as the one used by the World Food Programme, which has been running a continuous round of surveys. So the World Food Programme had a survey in July, August, and then again in September. And our survey ONS is done in October, December. So we get kind of this time view of coping under these conditions. And we see that households are using coping mechanisms that include having reduced quality or cheaper food, just shifting the composition of food towards reduced quality, cheaper kinds of foods. They've reduced their number of meals that they're having per day. That has that almost doubled. Cheaper quality food has gone up by almost 30 percentage points. And there's been a big increase in adults reducing the amount that they eat to allow children to eat. So from as little as 29% in September and 14% in May, in July, August, to about 60% when we did the interview. In terms of access to safety nets, the situation doesn't look great. Only 8% of household heads reported having any access to safety nets. Almost all of that is coming, 71% is coming from either UN agencies or international NGOs. Some 13% have gotten some assistance from government, and very little in terms of sort of household to household sorts of private mechanisms for ensuring. And that's consistent with the aggregate decline in earnings. Remittances have also fallen quite significantly. About 5% of households and homes report getting any remittances. And this is down from about 10% in 2019 in the last round of the IELFS, the last complete round in 2019-20. We turn next from there to kind of shift gears to looking at what's been happening to basic services. So let's start with what's been happening to school attendance. So here, we are not reporting here the either gross or net attendance, which is the conventional metric used. Since we're interviewing household heads, we actually asked the household heads what proportion of their children between 6 and 18 they were sending to school. Yeah. So that would be in primary school, secondary school, both. And so you can see that for boys, which is what you're seeing on the screen now, in aggregate, there's been about a 10 percentage point increase in boys going to school. And that is in both secondary and primary grades. So household heads reporting that all of their boys were in school between the ages of 6 and 18 went up from 41 to 60%. There's a little bit of a decline in households reporting that their boys are attending primary school only or secondary school only. Much of that has moved into all of their boys are attending school. And in aggregate, there's about 10 percentage point decline in household heads saying that none of their boys are attending school. Breaking that down by rural and urban areas, we see that for boys, there's an increase in both urban and rural areas, a somewhat bigger increase in rural areas of all boys attending school and across all grades, primary and secondary, a somewhat smaller but still very significant increase of all boys attending school in urban areas as well. When we turn to girls, in contrast, we do find actually in aggregate that there are more girls in school. In fact, there's about a 10 percentage point increase here as well, similar to boys in the aggregate in girls being in school. Almost all of that comes from girls being households reporting that all of their girls are in primary school. There's a decline in girls in secondary school, and overall households reporting that all of their girls across primary and secondary are in school has not changed at all. It's exactly the same. So the big push up on girls schooling is coming from primary schooling. When we break this up by rural and urban areas, for girls, the patterns are quite different. So for girls in rural areas, and that's the graph on the right-hand side, there's been an increase, a big push up in girls being in primary school from 8 to 21% of household heads reporting that their girls are in primary school, a small increase in secondary school from 25%. So households reporting that all their girls are in school, including secondary girls, very small increase but still an increase from 25 to 29%. In urban areas, in contrast, actually the aggregate is not changed at all. So there's no increase in schooling in urban areas. It's all coming from rural areas. And overall, there's quite a big dip in girls in secondary school, declining from 8 to 3% of households reporting that their girls are in secondary school only, from 40 to 29% decline in households reporting that all of their girls of primary and secondary school age are in school. A little bit of an increase. Some of that has been just that the girls in primary school seem to be protected in urban areas, but not in secondary school. And as a result, the aggregate school outcome is quite unchanged in urban areas. I'm going to move to the last point that we want to make, which is on access to health services. And here again, the news is actually somewhat satisfying in that the things haven't collapsed entirely. at all. So 81% of households in our survey reported during this period between October and December that they needed some type of medical attention. And of those households reporting that they needed medical attention, the vast majority were able to reach, almost the bulk of them were able to actually get medical help, right? And there is actually no difference in that between urban and rural areas. So they did urban and rural areas about as well. And there's also very little difference in this by gender. So if you look at this, a graph that breaks this down further, you can see that whether you look at men or women needing medical attention, they were able to access it about equally well. And whether you look at urban or rural areas, there's about equivalent access, yeah? So somewhere like 94% of households who needed medical attention were able to get it. And they got it from a variety of providers, public sector providers, private. So let's say about 41% are getting it from 40 to 40, let's say 40% or so are getting it from the public sector. The rest are getting it from the private sector, but they're able to access some form of help. So I think that's our last point. And this is just to acknowledge with a lot of thanks to the bigger team involved in doing this work and to the survey firm that helped us collect the data. Let me stop here, Sarah, and we can move on. I can either stop sharing or I can leave this on screen in case there are questions. Let me know.
Thank you very much, Ghazala. Perhaps we can stop sharing now, but with the option to go back to the extent that there might be questions that we can refer back to some of these graphs, because there's a lot of rich data presented, and I know that it can be important during the course of the discussion to go back and see some of the graphics that help sort of carry us along on this explanation. And so, again, there was a lot of information presented here. It was interesting and important findings. And so I'm really looking forward to the discussion that we're going to launch into now. And we're really pleased to have with us today 2 expert panelists who will offer their perspectives on the context around the survey results, as well as their implications for our international response. So first we have Omar Joya. Omar is the executive director and founding member of the Biruni Institute in Afghanistan, and he is also a researcher at the Bordeaux School of Economics at the University of Bordeaux. We also have Althea Maria Rivas. Althea Maria is a senior lecturer in global development, peace, and conflict at SOAS, the University of London, and she's written extensively about Afghanistan, including a recent book exploring the lived realities of local actors during the international intervention. And again, after the panel, we'll leave time for your questions. So do please send them along. I can remind again, but you can email events@cgdev.org. You can tweet @CGDevs, #CGDtalks, or submit a comment via the YouTube live stream. But Omar, I'd like to start off with you. What are your reactions to the data on employment? We see unemployment going up in urban areas, but down in rural areas. Your reactions to the related findings about food security. With less remuneration, families have less ability to cover basic food needs. We see coping mechanisms, including reducing dietary diversity and food quality. How do you see these findings fitting in with other reporting on economic conditions that you see?
Thank you, Sarah. Well, first, let me congratulate the bank team on implementing this survey at a very important time. It comes at a very timely, very timely, because as Melinda mentioned, since August 2021, we were in a sort of an information gap, and we were not knowing what was happening in the country. The government agencies, the National Statistics and Information Authority, and other line ministries in Afghanistan that were collecting data and statistics, all of those agencies stopped the collection of data. The high frequency data that we were getting through various surveys or administrative data that we were getting were all suspended, and we were really in a sort of an information gap. So this survey comes very timely, and it provides us, I think, with very useful information that every one of us were waiting for. And I think I have to mention this right upfront. This series of surveys have to continue on at least once or twice a year going forward. And I will come back to this in my concluding remarks. So in terms of the findings of the survey, I think we have very interesting results, and some results need some further deliberation and to think through to understand better what has really happened in the economy. And here I'd like to discuss just basically two aspects of that. First, the result on the fact that employment seems to have increased, and second, the fact that girls' access to schools, or girls attending schools, or households sending the school-age girls to schools have increased. So before I discuss the results on employment, I think we all have to take note of the fact that implementing telephone call surveys in poor countries and low-income countries is challenging, and it has its own limitations, and sometimes you usually end up running into some biases that you don't have any other ways to go around with that. For instance, so here in the sampling frame that the team have used, it's the sampling frame that comes from the representative household surveys, the survey that was implemented in 2019-2020 in Afghanistan. So there they had a sample of 20,000 households, but out of that 20,000 households, only half of that sample provided their telephone numbers. So you already actually went down from a sample of 20,000 households, which are representative at the national level, to only just 10,000 households providing their telephone numbers. I don't know whether was it just the fact that those households did not have a number, or they did not want to be contacted, and the team knows much more about that. But I think it just reflects the fact that a lot of the households in Afghanistan, they cannot maintain continuous access to mobile and telephone, because already you have a non-response rate of 50%, which is not unusual for Afghanistan or even for other countries, but I think it's much more important in Afghanistan, because according to the results of the 2016-17 household survey, the ALCS 2016-17, only 43% of the households had a telephone or a mobile in 2016-17. So I guess it could have increased to about 50%, let's say, over the past 2 or 3 years. But even too low. So you with a sample where you are covering the portion of the households which already have some sort of stable income generation activities, who they can maintain a telephone, a mobile in the country. Especially if you look at the regulations of the telecom companies, most of them, they just deactivate the number after 6 months, I believe, if the person does not add a top-up credit. And this has been something that I've always noticed, especially with the people that, for instance, we in our office, just a very practical example, we had some support staff working for us in Kabul, and when we had to suspend our operations, I tried calling them after 6 months. Their numbers are not working, and I believe it's just the fact that that they cannot maintain the telephone numbers operational. So I think we have to be cognizant of the fact that with these surveys, we end up with less vulnerable portion of the households, and I think this explains why the fact that the survey results show an increase in employment from 73% to 79%. And I think we have to actually interpret that with keeping in mind the limitations with these sort of telephone call surveys. And especially the fact that the number of the share of casual labor seekers, that the casual labor and self-employment was so much significant in the results that you're seeing. That also, I think, points to that. But overall, I think what we were seeing on the ground, I was in Kabul up to January this year, and I think the number of casual labor seekers and the people, the beggars on the street, was historically unprecedented. And was, I think that could be confirmed from various anecdotal evidences. And finally, on employment, I think there's also general critique of the conventional definition of the employment, especially how useful they could be for countries like Afghanistan, where you ask a person if the person had worked for an hour over the past week, or here in Afghanistan, even 8 hours that they have been using for the definition of employment. I think that just doesn't work out for countries like Afghanistan. People do not have a choice of being unemployed. I mean, we have to just accept that. So I think we have to actually think through some more definitions that could be much more, that could better contextualize the context. Second, on the girls' education, I think we all know that since August, girls have not been going to the secondary school at all. There might be very, very few exceptions, homeschooling or some other aspects, but secondary schools, that's for sure. But yet the results show that that there was a slight increase in girls attending. Households sending their girls to secondary school, although that was marginal, but even overall, I think for primary and secondary school, it was a quite significant increase. And I think this has to do with the definition that you've used, the question, the way that the question was formulated, because I looked at the questionnaire for the 2019-2020 survey that the NSIA had shared with us last year. And in there, they were asking this, the question was formulated such that, has this person attended the school over the course of this current school year? The 1398 school year, has this person attended the school? So of course, when you ask this person, when you've asked this question from anyone between October and December, the household head would have responded yes, because prior to August 2021, those girls were going to school, but then after that, they stopped. So I think going forward, I think this question has to be reformulated. The reference period that you're giving them, you have to give them, is the girl going to the school right now or over the past week? So as a conclusion, I think this survey is very important. This has to continue on because we're lacking a lot of the other data and information that were previously being collected. It will provide us with very important information that are critical for policy discussions going forward between the international community. And if possible, if the survey could be switched to on-site data collection, even if you do a smaller sample, yet on-site, I think it would still be very useful. My third suggestion would be perhaps we could try to add some additional questions, like to come up with a more contextualized definition for employment that would reflect better the needs of you can keep the current definition of employment, but then add additional questions that could better reflect the situation in the country, and again, for girls' school attendance, if you could reformulate the question or add additional questions with these reformulated language. If there's room, the survey could be expanded further. The scope of the survey could be expanded further to also track public confidence in the economy, because that's the critical information that we need, especially even if the macroeconomist teams in the World Bank would be working on growth projections. The public confidence plays a great role. I know that these perception questions and subjective well-being questions, they also have their own challenges, but I think it's worth mentioning it. And then finally, I think we just have to interpret the results in light of some of these challenges that are always there in such surveys in Afghanistan or elsewhere, and there's no other way to actually to go around these. But I think we have to be just cognizant of that. So I'll stop there. I think once again, congratulations for the team, and we all look forward to seeing the results of the next rounds of the survey. And I hope that it continues. Thank you.
Thank you very much, Omar. So there was a lot of questions and good points about methodology, definitions, as well as some concrete recommendations about survey administration. I would like to give Ghazala an opportunity to respond to those, but before that, I do want to turn to Althea Maria Rivas first with a question, with a similar question, sort of an overview of reactions. And so, Althea Maria, curious what your reactions are to what the data say, in particular about how people are engaging with health and education services. So in the last several months, the prevailing narrative has been one of concern about the collapse of social services. But the survey shows, again, little change in access to and use of health services. And for education, we see an increase in the use of education, especially for boys, but also an increase for girls in primary education, of course, while seeing a decline in secondary education. And of course, where the increases are seen, these are particularly pronounced in rural areas. So, what is your sense of this? Are these findings surprising? What's your sense of what these reflect? Thank you.
Thanks, Sarah. And also thanks, Omar. I think Omar made some really important points that I also thought were really relevant about context and methodology that I might touch on later, but I'll try not to repeat anything because we have limited time. So I think firstly, it's really important to have information coming from the communities to guide our policy and programming directions. And it has, of course, been more difficult to get that in the last year and the past few months because of a number of factors that we've already outlined. So I just wanted to recognize the importance of this survey initiative. At the same time, like Omar, I found this survey interesting to review, but also I found a number of the findings quite surprising. Particularly in terms of healthcare and education, and I'll just give two kind of brief examples because that's what Sarah's asked me to comment on. So first, I found the finding that 90% of the 81%, so a large percentage basically of the people surveyed who needed medical attention recently were able to receive medical care from public or private facilities. I think that's perhaps one of the most surprising findings of the survey for me, because I would argue that this has never been the case in Afghanistan. It is a country where healthcare facilities are insufficient across the entire country and are not adequate to service the population. Now, of course, this varies from province to province, with Kabul, being the urban center of the country and being better resourced than other locations. But in general, there's a real problem with access to healthcare services. But in addition to that, in the last 6 to 7 months, what we've seen from research that I've conducted and surveys that I've been involved in is a decline in the provision of healthcare services. And in some provinces like Takhar, Kunar, Zabul, Badakhshan, there have been severe decreases. And it's important to note that while in many provinces, though, clinics and hospitals may still be open, right? So technically, I guess, operating, and they may still have staff, services have been impacted significantly by a series of other factors. So for example, the decrease in working hours, so that they might be open, but they may not be open for very long, or they may not be open every day, or they may only be open one day a week, right? So again, it's about the details and the questions that you're asking. There's also a lack of pharmaceutical drugs and medical supplies, like there's the clinics may be open, but if they don't have bandages, gauze, drugs, like things to actually attend to people, then they can't provide services, right? And then while there is staff, those staff, like the well-qualified staff in a lot of places, may not be there. So people, doctors and surgeons with highly specialized skills may have left or migrated, whatever the case may be. So it's really surprising to me that those, 90% or that high a percentage of people were actually able to get medical care, because I haven't seen that in the almost 20 years I've been involved in Afghanistan. Second, and Omar touched on this as well, the increase in girls' primary education, or the maintenance of girls' schooling across the board, For me, over the last 2 years, I think is, we'd have to dig down a little bit further, but okay, I could accept that. However, the timetable is definitely an issue here. And again, what Omar touched on in terms of how we think about attendance and enrollment, and the difference there is significant. But also, I would think that we should be focusing on the recent changes in attendance and access to education. So when we look at the disruption over the last 6 to 7 months, for example, we find that access to education, particularly for girls, has been affected, and girls have been disproportionately affected. And this is due to things like, a number of factors, but new laws in different areas, okay, the change of administration, right? Whether, because it's become highly personalized and fragmented, so whether someone is in support in the local administration of girls' education or not, conservative views that have already existed, temporary or sporadic closures of schools. So yes, schools may be open generally, but if they close, for a week or, a couple of weeks or a month or a couple of days, then people may not be attending, right? In girls' school in particular, just access to, if they're nearby or not, right? And also local insecurity. So one of the other things that I wanted to pick up on is in the report, a number of times they talk about the, improved security situation. And I think we have to be careful that, we can look at security in different ways. So yes, there's no longer Western intervention, and, people are not perhaps being bombed in the way that, could have happened before, but there is still insecurity in many ways, right? And people are still frightened depending on who they are, what they've done before, and the relationship, patronage relationships, and kind of like local commanders and things like that, right? So there's still insecurity in the country. So we should be very careful about making that assumption. So I think when we look at schooling, when we look at education, we have to be very careful about how we are defining these things and the assumptions that are being made, because otherwise we're presenting a very skewed picture actually of what's going on. And I think the point that Omar made about self-employment, this is really important, right? Because the report kind of presents the picture that it says more people are being employed. But again, self-employment could be 1 day of daily wage labor for $4 in 3 weeks or something like that, right? So it is defined very differently. So like cash for work or things like that. And the amount of people definitely who are on the street or homeless, has significantly increased. And that is something that you can just see by visually. So what does this reflect? I think there's a couple of things. One is the need to focus on, to dig down a lot deeper, right? Afghanistan is a country that has always been strong at the subnational level. It's like, you can say fragmented, or, it has strong kind of like regional and provincial kind of personalities. And therefore, we have to take that distinction into consideration when we're looking at large scale service like this. Like, it has to be more specific, because otherwise what happens is you get a skewed picture of what's going on. So, some of the urban areas or areas where you have champions in particular things, or areas where the international community historically has focused on particular things like health or education, right, or infrastructure, right, will skew what's going on more broadly. And I think we have to be careful of talking about large scale pictures, because it is such a differentiated landscape. We also need to be careful about the assumptions around security, and I've already touched on that, and also the diversity in the country, right? So it really struck me that you basically only spoke to men. Though the I guess enumerators were female, I think 90 or over 80% of the people that you spoke to were men. There's also, no recognition of the kind of ethnic diversity and different religious affiliation. So there's so much that has to be pulled out of that to really get even a general picture, I think, of what's going on that's not in this short report. And I'm sure like in the demographics of the survey, you probably have that, but I think it's really important to focus on that when you're presenting results. Otherwise, it does give, I think, quite a skewed picture of what's going on. So I think for me, the survey report, it's interesting, and it raises a lot of very important questions about the way that we engage with research with Afghanistan that, has really kind of historically been the case, I think, with many of these types of surveys. As Omar said, doing surveys in areas where there is conflict is always tricky. Doing telephone surveys is even more, I guess, contentious or difficult. And then, we have to recognize that in terms of what the findings that we get from that research actually represent. And I think we need to drill down a lot further in order to really understand what's happening. And we have to root the questions in the context and culture of the place in which we're doing surveys. We cannot generalize, because otherwise you're not getting the information that you're looking for. You can generalize in terms of the information that you want. So you want information on particular types of health or education indicators, but then the questions have to specifically speak to how those things are located within the context. Otherwise, that's not the information that you're getting. And we need to be careful because, the country is in a very uncertain moment. We don't want to start making assumptions that then will put it in a worse position than it is now. And that is absolutely possible. Thanks. I'll just wrap it up there.
Thank you so much. This is a lot of really rich discussion. I do want to turn it back over to Ghazala to respond to some of this. I mean, I think, what I heard was, first, overwhelming support for this data exercise and the importance of being able to try to capture some of this data that, again, has been missing over the last 6 or 7 months and is an important complement to other sources of information that are coming out of Afghanistan too. But then, there are questions about thinking about what do the biases mean, right? And so, if implementing phone surveys is always challenging, if maybe half of the sample size provides a phone number and then a fraction of those, as expected, would actually respond to the survey. And then who are the ones who are answering the phone? Is it men? In this case, it seems to be largely men that are answering the questions. And then the questions about definitions too, and thinking about what does it mean to be employed? Does it mean to be long-term employed, steady employment, potentially short-term employment? Questions about what does it mean to go to school? Does that take into account the fact that schools may be closed for long or short periods of time, inconsistently, et cetera? And then also this question about being careful about averages too, cognizant of the heterogeneity across the country, across regions in particular, in terms of access to services as well. And so there was way more than I was able to summarize in these last 30 seconds, but Ghazala, I would like to turn it over to you for a quick response, and then we'll go back to the panelists with a couple more questions. Thank you.
Great, thank you, Sarah, and thank you, Omar and Maria, for very, very interesting comments. So let me start by first addressing some of the issues raised by Omar. Several really important issues raised. So first, yes, sampling, potential attrition, potential selection, all of these are very top of mind for us when we do these surveys. And a huge amount of effort was put by us into actually redoing the sample weights, checking attrition patterns, checking for potential selection along dimensions like cell phone ownership, because we take care of some of that in the reweighting. Is it perfect? I'm a big survey person, so I'll go with you and say yes. I would also say it's probably not perfect, right? But are the survey weights producing decently representative data? I think yes, because we put a lot of attention on that, right? So we do in round 2, and there are 2 exercises ongoing right now that may help with some of these questions as well. One is that we are right now linking the panel aspects of the survey. So we're actually linking these households back to their original 2019-20 and 2021 household data, which is much more detailed and rich data, right? And then trying to develop sort of like probe much deeper into potential selection, into other sorts of issues to do that panel data allows us to do. So we'll be coming out with that fairly soon. We're also, as you know, going with round 2, and in round 2, we plan to go back to all the households, including the ones whose phone numbers were off, because that can also switch. Yeah? Households may have temporarily turned off their numbers, they may turn them back on again, and so forth. So those patterns will tell us a lot about what's going on as well. But the key issue I want to talk about is that we did a lot of work on adjusting sampling weights with the most reputable group who does that globally, right? Which is Sistemas Integrales. They've worked with the World Bank now for I don't know how long. We work with them in a good bit of detail on this. So I think some of the most egregious problems with selection have probably been taken care of. Are there still issues? Yes, probably, right? But I don't think they would invalidate the results in any way. I would stand behind that, right? Now, in terms of things like unemployment and the definition of employment, I strongly agree with both of you on that. This is a bigger question than Afghanistan. Yeah? This is a question we've been tackling globally, I don't know how long, right? How do we define employment in countries, in developing countries? What does that mean? How do we look at underemployment? This is not a problem that is in any way specific to Afghanistan. The importance of collecting data using more or less the same terminology across the board is that you get a time frame, right? The IELFS and the other service providers are also using the same definitions, right? So we can't suddenly go completely in a different direction because that would not give us a good metric of trend, right? That said, should we go deeper? Should we look at things like underemployment? Should we look at the quality of employment? Absolutely. Phone surveys are not the right vehicle for that, as you both know very well, right? You can't keep people on the phone for a couple of hours, which is what we do in field surveys. We sit with them maybe over 2 visits, over maybe 2+ hours, right, to get very detailed data. Would we love to move to a field survey? Yes, I'd love to go and say that either the next round or at least the round after that will be in the field. We've already started having tentative discussions with the team on that because that's our strong preference, right? That allows us to deal with so many issues, particularly the kinds of issues that both of you are raising on quality of not just did you get healthcare access, but what's the quality of access? And I'll come to that point in a bit. So yes, we would like to do that very much. On schooling, I do think that we do find this big decline in secondary schooling. I was quite clear about that. What we are finding is an increase focus for girls almost entirely on primary schooling, right? So let's be careful about that, right? Schooling in secondary or secondary schooling does show a decline. Primary schooling shows an increase. And for girls, that increase is concentrated in rural areas, right? And yes, there's not been an overall increase in security and all aspects of security, but there has been an increase in day-to-day security. I think there is some evidence for that. That's coming out quite clearly. And that may have facilitated girls who were just out of primary school getting to primary school, right? Secondary school is a whole other ballgame. And we do see a decline there. On Althea Maria's points, I think what I liked actually was, I wanted to make 2 points. Number one, our healthcare statistics are actually quite well corroborated by the data coming out of the WHO, right? On the maintenance of health services, including things like vaccination. I was going to actually see if I could put up that chart, but I don't actually have it in front of me. I can actually share it later. Particularly, this shifted starting October as UN agencies started to move back in, money started to flow back in, and health services were up and running. So our survey comes between October and December, not in that August, September early period, when yes, there was a bit more of a shock on healthcare services. We're also hearing similar things from the Red Cross, which is saying that there's been a dramatic increase in people coming to health services to seek care, people who were not previously coming. So it's not just from our survey, we are seeing corroborating evidence from data being collected by the WHO, by the Red Cross and others who are on the ground there. The thing that I liked a lot about your comments had to do with the quality of care, the quality of school, right? Where we move in from like where you're able to get to a health facility to what is the quality of care you got, right? Similarly, you're able to maybe schools are open, but is the quality of schooling impacted, right? We are currently not able to say anything about that. The survey was not designed to get at those issues. Would we get at those issues in a field survey? I suspect yes, right? And we would try, and I've made note of that we try and get a little bit more detail, maybe even in the next round of the phone survey. But certainly we would, when we move to the field, we would be very, very, very keen. And I would love to sort of also interact offline and see whether we can add questions that are of particular interest for both of you have a really good sense of things on the ground. So it would be great to say, okay, let's see. It's always good to improve questionnaires and our approach to asking questions. So very open to that. Let me stop here, Sarah, and turn back to you. And
Thank you very much, Ghazala. So we have just a few minutes left. And so I'm going to ask a question of both panelists now to respond very briefly. And I'm afraid it's a question that deserves more than the time that we'll have allotted to answer it. But this combines a question that I have myself, as well as 2 questions that we've gotten from the audience as well. And so I'll sort of try to lump them all together in one. And this is really a question about what are the implications of this survey data for international response? And so, how do you see, in particular, looking at sort of the financial, the economic performance in particular, we see that the liquidity crisis may be abating somewhat, but how do you think about the role of the international community in helping to support economic stability in Afghanistan? And then Althea Maria, there are ongoing conversations about how the international community can support service delivery, either through state institutions, which has become more challenging, of course, with the sanctions on the Taliban, or through NGOs or community development councils. And so I'd be interested to see how you see this data and other evidence fitting into those conversations, both about sort of the need and the imperative and the how of international support to try to help move some of these indicators in a different kind of direction. Omar, I'll start briefly with you. And again, just because we're a bit short on time, it would be great to keep remarks to just a couple of minutes if possible, but I know that's a loaded question. Thank you.
Yeah, thank you, Sarah. Well, that's a difficult question to answer. I know that the international community are now deliberating on how to actually go beyond humanitarian operations in Afghanistan and to re-engage in some of the development programs. And I think when over the next few months, when some of these agencies, institutions, donors, or NGOs will be working on designing some of the development programs, they would actually need to take account the changing same structure design of the projects that you had previously in some of the very large programs like Citizens Charter that were designed very complexly, that had very complex designs, or other national programs. I think they need to take into account the changing context, reprioritize some of their operations. Right now, I think there might be much more need to actually to engage in development assistance that would help generate income and stability for the household. Despite the fact that we did see some increase in employment and let's say in school outcomes, I think still the overall results of the survey is not encouraging. And I think, as I said, we just have to see the results of the survey in light of the limitations that it has. I don't think that we could comfortably argue that it just nationally represents the situation, and we have to complement that with the anecdotal and qualitative information, the vast amount of qualitative anecdotal information that we receive through media, through very different sources of civil society, and we must not see the results of the survey in separate from those types of information that we had. After Maria mentioned about the fact of security. Now I mean, just arguing that security has improved, I don't think that a lot of people in Afghanistan, the Afghans, would actually be happy with that. So I think we just need to take into account the changing context. Thank you.
Thanks very much, Omar. And Althea, Maria, over to you.
I agree with everything Omar's just said. And I guess the two things to stress is that, and Ghazala also mentioned this, you need to rely on people who are on the ground. Like, I think the international agencies, a lot of them have not had a lot of staff in the country, not just post the Taliban takeover, but after that. So the view that they have of what's going on the ground in the rural and remote areas, and really in the provinces outside of Kabul, is very, very limited. And so I would encourage international organizations to engage with Afghan civil society, local research organizations who are able to access those areas to inform the policy and programming direction moving forward. Otherwise, we are going to, again, make mistakes. I think we also have to look at lessons learned of international programming, like what happened with some of the large multi-donor funds, like, this is the World Bank, the ARTF, right, or LAFTA, right, and not the success stories, but what were the major mistakes that were made over decades with some of those funds? What are the mistakes that the international community made that we don't want to repeat? Because most of the conversations have been focused on, how do we deal with the Taliban? And for sure, this is a massive, complicated, and big question. But we also don't need to use revisionist history and pretend that we have not contributed to the humanitarian crisis and to the development challenges that that country is facing right now. So it has to be balanced in terms of learning from our mistakes and trying to not repeat them, and also engaging with local actors, because I think also the engagement with local actors is one way to tie or to move from just humanitarian assistance into the development assistance, because a lot of that has to do with chronic poverty, right? And so thinking about how we kind of address those things, not necessarily tying them together in terms of like multi-mandated programming, but engaging with the realities on the ground of what, how persistent and chronic humanitarian needs and poverty can lead to, chronic poverty can lead to kind of persistent humanitarian challenges. But really it is about getting the view from the ground and letting Afghans kind of lead that, and not focusing on international assumptions, which can be really, really misleading.
Thank you so much. This has been a great discussion today. I was thinking through some of the things that I've taken away from the conversation, and certainly more than I can summarize in the next 30 seconds that we have here. But I think, the key takeaway here is that, there are people who are suffering in Afghanistan. A lot of this has come as a result of the loss of jobs and income in particular. But another big takeaway is that, it really is important to have data coming from communities, from people who are living in Afghanistan, and that these experiences will be central to informing any kind of response to be able to understand it. And so this points to the relevance of this particular survey, as well as other information as a useful source of analysis. The World Bank in particular, has historical data that it can draw from, as well as tools to analyze them, and puts it in a unique position to sort of give voice to various different segments of the Afghan society and different pieces of the puzzle in terms of what are we seeing in terms of development outcomes there. And when other sources of data were no longer available, of course, this has been a data source that has been able to persist and becomes a useful complement to other sources of information, qualitative and anecdotal information. But at the same time, as Omar pointed out, it is important and critical to continue to complement, again, this quantitative data from the World Bank with this other qualitative and anecdotal information to be able to get sort of a more complete picture of what we see happening and how Afghan households are experiencing their lives right now. And so, I think to conclude, we'll look forward to future iterations of the survey. I mean, again, as Omar mentioned early on, there's a lot of importance in continuity. Certainly the crisis in Afghanistan will not persist in its current form indefinitely, but prolonged challenges will remain, and fluidity is to be expected. As Althea Maria said, we need to be able to think about, in terms of the international community and the donor response needs to really interrogate the lessons from the past. And it is useful to have surveys like this from the World Bank to provide one source of critical information that can help provide some signposts sort of on this path ahead. And so the Afghanistan Welfare Monitoring Survey is available now. It should be available on the World Bank's Afghanistan page. We will also provide a link to it on this event page on the CGD website. And I want to thank all of you for joining us today, and really special thanks to Melinda Good, to Ghazala Mansouri, to Omar Joya, and Althea Maria Rivas for sharing your expertise with us today. Thank you all.